Hi everyone, I am Dr. Arjun SK, consultant neonatologist, Cloudnine Hospitals, Kanakpura Road. Coming to the signs and symptoms, so it can be classified into three stages in the newborns. First is early onset COVID. Early onset COVID is seen in newborns who got infected between 2nd and 5th day of life. So usually this happens because of intrapartum or during the time of delivery, if the baby gets infected during the time of delivery. So in this situation, the child may present with or without symptoms of COVID. 90 to 95% of the newborns are usually remain asymptomatic. They won't show any symptoms. So remaining small bunch of newborns, they can have mild symptoms in the form of fever, hurried breathing. Some newborns can have gastrointestinal symptoms like diarrhea, vomiting and refusal of feeds and other things. And there are many case reports which have shown very severe form of COVID also, requiring ICU with ventilation and other things. Coming to the second type, late onset COVID-19, this usually happens between the 5th and 7th day. So usually this group of newborns, usually they get discharged from the hospital and again they come back. So during the stay in the early days of hospital, the COVID test would have been negative. Again they go home and come back with symptoms of COVID. So here the most common cause for acquiring infection is secondary to mother or caregivers who are not caring properly and not maintaining proper respiratory hygiene and contact with the newborn without taking any precautions. So in this group also the newborns present with many symptoms in the form of fever, very dull look, refusal of feeds and loose stools, vomiting, diarrhea, and the symptoms can vary, and the blood picture can also show elevated what you all know, that D-dimers, ferritin and other levels. So coming to the last type, this is called what you hear frequently in the news channels, MISC, M-I-S-C. Now in newborns we are designated as MISN. So that is multisystem inflammatory syndrome in children or neonates. So this novel condition, it occurs usually following the COVID-19 infection. So here what we need to understand is, there are few situations where parents or caregivers, they doesn't know that child had infection prior or the babies had any COVID infection prior. So in this situation, what will happen is the child presents with the emergency with sudden onset of high grade fever, and few kids will have rashes on the body and also redness of the eyes, and many newborns present with shock in the sense the extremities or peripheries of the baby will be cold. Sometimes it can turn purplish blue, and also the heart rate will go high, and also the baby will have very depressed look, refusal of feeds, and also GI symptoms like gastrointestinal symptoms like vomiting, diarrhea, loose stools and refusal of feeds. And also some newborns can have the manifestations of fits, what we call convulsions, in the form of uprolling of eyes and many other things. So any child or any newborn presented with sudden onset of high grade fever with hurried breathing, rashes on the body and redness of eyes, and some cardiovascular symptoms or peripheries becoming cold and refusal of feeds and any abnormal behavior or fussy thing, so please immediately take attention. It can be a MISI, because when we retrograde, when we ask few questions for the parents, they tell, sir, 1 month back, 1.5 months back, baby had just 1 day of fever, cold, cough, so it went off by itself. So when we check the bloods and when we do the COVID antibody levels, so the COVID IgG will be positive. That means the baby had COVID 1.5 months prior. So but it has not manifested, and what we call that as asymptomatic COVID time, and later they have many other inflammatory markers which have gone high beyond the normal range, proving that it is a MISI or MISN.